to UHP. Dr. Logan here again, talking about some more myths, this time moving up to the neck and things that can cause neck pain, and some myths around that, some things that I hear from people a lot when I'm talking to them about their issues, whether it be neck pain or more commonly something going on in their shoulder or their arm, and they want to get that taken care of, but the issue may be really coming from their neck. So we'll go through all of these, mostly talking in this first point about location of pain and what's going on based on where someone has pain that could be coming from the neck. First of all of these issues here that we see, jaw pain or TMJ issues here, shoulder pain, shoulder blade pain, things hurting around the chest in this area, sort of like the collarbone and sternal area of the chest, headaches, all of these things can come from the neck. And if I'm seeing someone in the clinic and they have, let's say, TMJ pain, shoulder pain, then based on our conversation and the behavior of that pain, we may need to look at the neck and screen it, see if it's involved, see if it's the origin of the problem. And at least, at the very least, we would want to rule it out of being involved, because if it is, we could waste a lot of treatment on someone's TMJ pain, someone's shoulder issues, and really not get anywhere because we're not addressing the true source of the pain or the true source of the problem, which could be the neck itself. Very typically, anything in the shoulder that creeps out as far as pain location wise, out here and down in the arm, especially below the elbow, going to be very suspicious to me anyway that it could be coming from the neck, especially if that pain starts going up toward the neck itself. Same thing with the shoulder blade. If we're having pain on the back side of our body here around the shoulder blade itself, very suspicious that the neck is involved, needs to be looked at, because it's very hard to injure our shoulder blade itself. But it's a very common place for neck pain to creep down from the neck and settle down here in the shoulder blade itself. So anytime we're talking about shoulder blade pain, it makes me suspicious of the neck, something that needs to be looked at. Same thing with headaches. Headaches can be caused by a whole bunch of things. Most of those things we can't treat with physical therapy. But there's certain types of headaches that do respond well to physical therapy, and in that case, if it is a mechanical neck issue causing the headache, then you could take whatever medication you want, adjust your diet, all of the things that people will suggest that you do if you're having persistent headaches, and none of those other treatments may have much of an effect unless the neck itself is addressed. So those types of headaches that can start here in the back, creep up to our head in this way, or maybe be on one side only, what we classically call like a ram's horn presentation of pain creeping up around the side of the head or to the back of the eyes kind of sensation. Those types of things, especially if they're associated with neck pain or someone that has a history of neck pain, make me suspicious of the neck. We need to check that out. Chest pain, what I mean here, not like you're having a heart attack chest pain, but pain that may be showing up around the collarbone, around the sternum, around this front area, around the pec. If the clinical presentation suggests that it is maybe neck related or other things have been ruled out, especially causes of chest pain that could be heart related or lung related, then that also comes into mind, maybe has a neck component. So a lot of misunderstood areas of pain around the neck and places it can send pain. One of the other big areas I talk with people at is that their arm pain, numbness in the arm, tingling in the arm, even weakness in the arm is caused by some arm itself injury or a shoulder injury. Typically, these things, especially the numbness, tingling, and certain types of weaknesses in our arm, forearm, hand, wrist, shoulder even, those things are going to be associated with nerve compression, nerve irritation. So if that's happening, the most likely source of that nerve being irritated is up here at the neck, not somewhere in the arm itself. It's more than likely happening up here in our neck, and then we're just feeling those issues down in the arm. Okay? So especially the numbness, tingling, And like I said, certain types of weaknesses can point to the neck as being the origin. And would definitely need to be looked at or ruled out if we're feeling those sensations. Numbness in the fingers, tingling in the arm, things like that. And then lastly, posture plays a huge role in the in our neck, and maintaining good posture can reduce a lot of these issues, especially with anything involving us being seated, staring at a computer screen all day. Our neck will almost always end up in this protruded position, or if we're staring at our cell phone and we're looking down or protruding our head to look at our cell phone for long periods of time. Driving is another bad culprit there, where we've got our hands on the wheel or one hand on the wheel and we're focused on driving. Almost always our neck and our shoulders will sort of fall into this really relaxed position, which is not good for our neck and can be sometimes the source of all of these problems. So if you're having neck pain or any of these other things we've talked about that could be forms of neck pain, then addressing your posture is key. Keeping our head over our shoulders and over our body the way it's meant to be, and not forward of our body, because then it's hanging here by our ligaments and it eventually will cause problems, even if it's just local neck pain. So once again, these myths that I talk about with a lot of patients, whether I'm seeing them for, well, of course, neck problems, of course, but any of these other things we talked about, like arm and shoulder issues that present in that way, but maybe really just a neck issue. So we would definitely treat the neck and then see what may be left over after all that neck pain is abolished. Thanks for watching the video, guys. Make sure you like and subscribe so you can see more physical therapy content where we want to resolve pain, promote your independence of care, and restore function.